Hey, deserving listeners, it's just me. Let me tell you something. When it comes to diagnosing people, the internet is stupid. The internet is just plain stupid when it comes to diagnosing people. And let me explain. Someone from a magazine asked me to provide some opinion because they are writing a piece on diagnosing characters from Game of Thrones. And I gave them a few of my opinions, a few quotes. But then I went online to see what others were saying, and I was astonished at all the bad information out there. To some of you, you might wonder, you might be astonished at my astonishment, but I thought I would find at least, I don't know, a few articles with accurate information written by clinicians. But the first page of Google searches brought up a bunch of bad articles written by people who clearly have no idea what they're doing, even clinicians, by the way. So I tried the second page of Google Hits, and the same thing. A bunch of bad articles written by people who clearly have no idea what they're doing. So I tried the third page, and same thing. So in this episode, I'm going to provide a critique of these popular websites and what they're saying. And I'm also going to provide a diagnosis for several Game of Thrones characters from my opinion. This episode is going to take a while. I'm guessing at least a couple hours. So get ready for a lot of Game of Thrones talk. This is the Psychology in Seattle podcast. I'm your host, Dr. Kirk Honda. I am a professor and a therapist. Just so you know, before we get going, I'm going to spoil everything up until early 2017. So I'm going to spoil everything up through season 6 of the TV show and up through book 5 in A Song of Ice and Fire. So just know everything's going to be spoiled. So go out and watch the show, read the books if you don't want things to be spoiled. Okay, so let's get into it. I'm going to do it by alphabetical order from first name. And we have Aerys, the Mad King Targaryen. He is not in the TV show very much. He's a historical figure. He happens before the first book happens. He's the Mad King that Robert and Eddard and the Lannisters overthrew and put Robert Baratheon on the Iron Throne. So I'm going to, with each of these characters from Game of Thrones, I'm going to give some quotes from different websites, and then I'll provide my opinion. So with Aerys, the Mad King Targaryen, the popular website that I found was a blogofthrones.com, a blog of thrones. And they identified Aerys, the Mad King Targaryen, the one who wanted to set King's Landing on fire. He identified the Mad King as suffering from pyromania. And in this instance, he's actually, whoever was writing this article was actually correct. It's one of the, I knew I was going to talk a lot of crap about a lot of websites, but in this instance, the blogofthrones.com, actually, they were correct. But let me go into Aerys Targaryen a little further beyond pyromania. So yeah, he suffered from pyromania. Let's go through the DSM-5 criteria for that. A, repeated deliberate fire setting. Yes, he had repeated deliberate fire setting. For instance, he burned Rickard Stark alive. This was Eddard's father. Tension or affective arousal before the act. Yes, according to the books, it made him horny to think about starting things on fire. Fascination with fire. Yes. Did he derive pleasure from fire? Yes. Was the fire not for any particular gain, like arson, that for insurance purposes or something? Yes, he often shot himself in the foot to see things burn. He loved to burn things so much that it actually got him killed in the end in some ways. I mean, in addition to a bunch of other bad leadership skills that he presented. Also, is it not attributable to some other disorder? And I would say, yeah, it's not attributable. So he really fits the full criteria, although he's not a classic case, because if you actually read case studies with classic cases of pyromaniacs, as we might call them, I wouldn't say pyromania was his primary disorder. His primary disorder is schizophrenia, and or some other psychotic disorder. It could have been bipolar with psychosis or something. It's hard to tell because it's not like the books give us a full, course of his mental illness. But I would say the most likely diagnosis that we would land upon is schizophrenia. Oh, by the way, before going forward, I just want to say something up front, and people who've listened to this podcast know this. The issue of, or the practice of diagnosing mental illness from the DSM-5 is a complicated one, in that if you have a medical condition like a broken bone, you fall off a ladder, you break a bone in your arm, you go to the emergency room, they take an x-ray, they see a broken bone, they actually see the bone is broken. They send it to a radiologist. The radiologist looks at it and says, yep, broken bone. They send you to a bone person or someone else, and they diagnose whatever their diagnosis is. Broken bone of the blah, blah, blah bone. Treatment plan, set the bone, and, put a cast on, physical therapy, that kind of stuff. So that's in the medical profession. In the psychological professions and mental health professions, it is not like that. Not usually anyway. Someone comes into my office and I can't scan them with an x-ray. I can't take their blood and look for biomarkers that suggest a particular syndrome or condition or disorder. I have to usually just ask the client to tell me what their experience is, or what they feel, or what they typically do on a typical day. And then I use the DSM-5 to guide me toward a likely construct, is what we call them. We don't call them things. Because a broken bone is a thing. When you have a broken bone, there's no subjective reality to that. You have a broken bone. But when you have depression or anxiety or PTSD or schizophrenia, these are things that, as a profession in mental health, we construct. For instance, we have different types of schizophrenia, for instance. Well, we could, if we wanted to, if we just got together and decided to, we could say that all those different types of schizophrenia are actually different disorders. We could, have 4 different disorders that we could split them all up. And we do this actually in our field. The DSM will take disorders and split them up and combine them and move them around and change them over the years. And so, whereas broken bone, that's been the broken bone since the beginning of time. I'm guessing the ancient Greeks and the ancient Chinese cultures and the ancient American cultures, they all knew what a broken bone was. And so I'm just guessing. But the idea of mental illness has changed as culture has changed. And in 100 years, I guarantee you, our construct of mental illness will change along with it. Now, some things will probably remain stable, schizophrenia probably being one of them. But it's hard to tell, because they have changed over time. So as I provide my opinion on applying labels and constructs to these fictional characters in these books, keep all that in mind, that this is not a hard science. This is not something that I can, even if I had a real human being that I was assessing, I couldn't take a reading and mark a number into the client file, and determine whether or not it means this or that in reality. It's just things that we construct as a guide for treatment. When someone seems to fit these criteria, we apply this label of schizophrenia because that helps us to treat them and to understand what will likely be the course of their issue as they present. Someone comes in with schizophrenia, well, in all likelihood, in 5 years, they're probably still going to be suffering from that. And these are the medications that are going to work, and these are the psychotherapies that might soothe the client. These are the family systems issues that might help. These are the other things, there's all these just guidelines really, and they're very squishy. For some people it'll work, and for some people it won't work. So it's an imprecise science. And so as I provide my opinion, although I'll probably sound a little pompous because when I read these other websites and what they're saying, it's laughable. And to any clinician, honestly, it would be laughable, or any clinician knows what we're talking about, because some of these are actually clinicians that are writing. But understand that you could argue with me, anyone could argue with me, and that would be legitimate. There are particularly when we get into personality disorders, my God, the people argue about those kinds of things all the time, mostly because we don't really know what it is, and everyone is sort of describing a different thing. While I'm on this jag, I just kind of want to do this. One of the things that I will lecture about to my students is the definition of rap. Okay, everyone understands what rap is, right? Well, when I was growing up in the 80s, Beastie Boys were a rap band or a rap group or rap outfit or rap whatever. Hip hop, the term hip hop didn't really emerge as a popular term until the early 90s. But in the 80s, you had Beastie Boys, and you had Run DMC and Vanilla Ice and MC Hammer, MC Hammer, Ice Cube, Ice-T, these MWA, these people, Public Enemy. This was referred to me as rap music. Well, I don't know, I'm dating myself, but probably like 10 years ago or something, I was talking with some clients who were teenagers, and one of them said, I said, oh yeah, rap, like Beastie Boys or something. And they're like, oh, Beastie Boys, that's not rap, that's rock. So they said that Beastie Boys were rock. Okay. So at the time I thought, well, that's ridiculous. Of course, Beastie Boys are rap. But really, it's all a matter of classification. What do you define as rap? Do you define rap as being, as having these criteria or a different set of criteria? According to my criteria that I absorbed or, sort of solidified in the mid 80s mainly during the Run DMC popularity times, whatever criteria I have for rap, particularly the early Beastie Boys, they qualify as rap to me then, and they still do. To someone else, they have a different set of criteria for what rap is. So, but neither one is right, you understand? Like, no one can say what rap is. It all just depends on how you define it. Well, mental disorders are exactly the same way. All the disorders, a group of people get together and decide this is the label, and this is how we're going to define it. And the criteria are also in the eye of the beholder, right? So let's say, with rap, we say, well, you have to talk instead of sing. You're not singing like la, and how do you define singing? Extended vowels with a tonality to it, like la, 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 that's singing. Whereas rap is da-pa, da-pa, hello, my name is Kirk, and I'm here to say I like to work and I like to play. My God. So that's one criteria. Well, what about certain kinds of hip hop where it's sort of like singing, but it's also kind of rhythmically talking? I mean, in some ways you could say Bob Dylan in a lot of his songs wasn't singing. He was just talking, It's not really tonality. It's just, so was he rapping? So the criteria are in the eye of the beholder. And again, it's just different individuals making different decisions about different criteria that are for different labels that we call diagnoses. And the term diagnosis is confusing because, again, in the medical field, when you have a broken bone, the diagnosis is probably universally accepted among physicians. Everyone looks at, broken bone disorder of the blah, blah, blah bone. I'm guessing, or at least I'd hope, that if, everyone looked at an x-ray, they'd all say, yep, that's the diagnosis. Well, in my field, you present someone with what some people consider narcissistic personality disorder to 100 different mental health clinicians, and even ones that know what they're talking about, I guarantee you're going to get a lot of different opinions. Well, that's why it's a construct, and it's cultural, and it's in the eye of the beholder. So take everything that I'm about to say with that in mind. Having said that, there are certain conventions that I know are established in my field that a lot of these websites that I'm going to critique are going against. They're not following the normal convention, and they're not using the normal criteria, and the eye of their beholder is not anything close to what the typical bell curve of clinicians would exhibit. So anyway, all right. So Aerys, the Mad King Targaryen, a blog of Thrones says pyromania, and I agree. And the second diagnosis for Aerys Targaryen is schizophrenia. And let's go through the criteria here. All right, so you need 2 or more of the following to qualify for schizophrenia. First, you need delusions. That's 1 out of the 5 things that you need. So you need 2 or more delusions. Yes. He had several grandiose, paranoid, health-related, persecutory delusions. He thought he was going to be the best king in history when he became king, which is, you could call it a grandiose delusion. He didn't let anyone touch him, which is a delusion of that touch equaled harm. He was highly suspicious of everyone, most notably Tywin Lannister and Prince Rhaegar, which is an example of paranoid delusions. So we got that one. Hallucinations. There's no evidence of hallucinations that I can remember from the books. Disorganized speech. Again, no evidence that I remember. Disorganized behavior. Yes, he had mood swings. He had strange behavior that was seemingly unrelated to the situations. Bouts of crying, bouts of, getting super angry and explosive outbursts, and severe joy without any reason. So that's what we might call disorganized behavior. Any negative symptoms? No evidence of that. So he meets he got 2 of those. So he just met the threshold of schizophrenia there. Level of functioning has suffered. Yes, he's not a good king at all. And did it persist for 6 months? I don't remember that specific in the books, but I'm pretty sure it did. So really, when it comes to schizophrenia, Aerys Targaryen is actually a mild case. He does meet criteria, in my opinion, and but it's a mild case because he only meets the criteria somewhat. The problem is that he was king and could do a lot of damage with his problems, right? So there's that. The other diagnosis is psychopathy or antisocial personality disorder. In this talk that is already super long, and I'm only 1 character into this, oh my God, how long is this going to take? I'm going to use psychopathy and antisocial personality disorder for the most part interchangeably, although they are slightly different. Some people consider them to be the same thing in my world, and some people in my world consider them to be slightly different. But I'm just going to use them interchangeably because that's my preference. Because basically the core of psychopathy or psychopathic personality disorder and the core of antisocial personality disorder are basically the same. You could argue with me if you want, and that's fine. But Aerys Targaryen showed definite signs of psychopathy and antisocial personality disorder because just because you have paranoid delusions doesn't mean that you kill a bunch of people without any remorse and without any thought or any empathy. People with schizophrenia, with paranoid delusions, they have empathy. There's nothing barring someone with schizophrenia from having empathy or remorse. So we have to, because Aerys was just so sadistic and terrible, we have to probably acknowledge some level of psychopathy and antisocial personality disorder. The other possibility here is paranoid personality disorder, which is, I've talked in other episodes about personality disorders, and I just have to say another caveat from the start is if you're not a clinician who has expertise in personality disorders, I can almost guarantee you do not know what a personality disorder is. Personality disorders are so confusing. It took me years to understand what the authors and what all the researchers were talking about when they were talking about the different personality disorders. I remember taking, a couple years of school in my master's studying different personality disorders and just really like going, huh? And really it wasn't until I encountered people with particular personality disorders, it wasn't until then that I really was like, oh, I get it. And there's no YouTube video that's going to help you, and there's definitely no text that's going to help you. You have to experience these human beings in all of the full breadth of their personality. Not only the full breadth of their personality, but the way it feels to you when you interact with them, which is actually a pretty good set of data. I always use the way someone makes me feel as a guide regarding personality disorders. So I'm going to say that as a caveat as we move forward to that, because a lot of people talk about personality disorders on the internet about Game of Thrones characters, and I'm going to as well. But just know that in this talk, I'm not going to be able to convey to you what that means, what personality disorders exactly mean. I can convey to you what schizophrenia is for the most part. I can convey to you what PTSD is. I can convey to you what pyromania is. I can convey to you what depression is. But personality disorders, just people out there, please, for the love of God, just understand that unless you are an expert in that area, you don't know what it is. And there's no way you're going to be able to find out. And there's no YouTube video and there's no article. There's nothing other than experiencing people in a clinical setting with clinical guidance about what you're looking at. You are just never going to know what that is. And the reason why I'm saying this is because I see a lot of people throwing around personality disorder labels. Trump has narcissistic personality disorder, was a big one that has been happening a lot lately. In the past, it was Obama that had narcissistic personality disorder. And people just need to stop. They just need to stop that. There are things in the medical field, like again, getting back to the medical field, when I have a broken bone and my bone is sticking out through my skin, I don't need to be a genius, or I don't need to go through a bunch of medical education to understand that my bone has broken in my arm. So there are some medical conditions that are, easier to diagnose than others. Whereas other kinds of things like, I don't know, an autoimmune disorder of the, that affects the lining of your intestines or something. My guess is that it's harder to, understand what that is, or MS or something. I don't know. There's probably certain medical disorders that medical professionals pull their hair out when they look on the internet and see everyone diagnosing people with it, when medical professionals fully know that it's a very complicated disorder that requires an expert to really understand and to really look at an individual in their entirety to even begin to guess that they might have that medical condition. Well, personality disorders are the same way. Anyway, so Aerys, the Mad King Targaryen, one could argue he suffered from paranoid personality disorder, since he didn't exhibit hallucinations or disorganized speech or the negative symptoms that are associated with schizophrenia. It's possible that he had paranoid personality disorder instead of schizophrenia. He was highly paranoid. It seemed to be a persistent personality trait in him. He was obsessed with who was loyal and who was not, and his mood swings could have been a result of him feeling as though everyone was out to get him. So we could be seeing a paranoid personality and we're mistaking it for schizophrenia because it just happens to kind of look like that. Now, again, in my caveat, I said that there's no biomarker between schizophrenia and paranoid personality disorder. It's in the eye of the beholder to some extent, and so just know that. All right. So that's so in conclusion, for Aerys, the Mad King, I would say either schizophrenia or some other psychotic disorder, some other disorder that involves psychosis, or paranoid personality disorder. I kind of like paranoid personality disorder to some extent. Pyromania, definitely, but it's a kind of an atypical case to some extent, and a dash of antisocial personality and psychopathy, maybe traits of it, if not the full blown disorder. All right, let's go on to Alliser Thorne. You remember Alliser Thorne, good old Alliser. He's the guy who always hated Jon Snow at the wall. All right, a blogathrones.com says narcissism. And quote, when a person has an inflated sense of their own importance and complete disregard towards others, often seeing them as inferior to them. His speech to the Night's Watch when announcing the death of Jon Snow confirms it, as he centers most of it around himself, unquote. Yeah, well, what I would say is narcissism is not a diagnosis. So without a standard definition, anyone can call anyone a narcissist. So I don't know exactly what to say to a Blog of Thrones in that way, because narcissism is these articles were all saying these are mental illnesses, and so just even the terminology they use just indicates it's like you don't even know the terms. But anyway, so narcissism is not a diagnosis. What I would say is Alliser Thorne, there's no evidence of mental illness. I read other articles from clinicians even that were saying that he had narcissistic personality disorder. I mean, again, with different eyes of beholders, you could absolutely, whenever I say that eyes of beholder, I think of, because I'm a D&D player, the beholder thing. But anyway, Alliser Thorne, in my opinion, there's no evidence presented in the books that he has any mental illness at all. He's just massively insecure, in my opinion. He is frequently trying to humiliate and put down Jon Snow, which we see, but that's just a classic sign of massive insecurity. I'm guessing his father humiliated him a lot, or he was bullied a lot as a kid because he bullies Jon Snow all the time. It's just a defensive projection. He's projecting his internal sense of his own incompetence and his own weakness onto Jon Snow and then attacking Jon. This is what we call making the internal conflict external. It's a defense mechanism that people do all the time. But that's not a mental illness. It's just a common defense mechanism that everyone uses. So in conclusion, Alliser Thorne, no evidence of mental illness, and I wouldn't say narcissistic personality disorder. For whatever reason on the internet, everyone loves to apply narcissistic personality disorder. It's a very trendy thing. And I think part of the reason is because everyone, maybe particularly Americans, I don't know, everyone hates someone who brags, everyone hates someone who tries to get power, and everyone hates Alliser Thorne. I don't know. It's funny. I've done a lot of episodes on Game of Thrones for this podcast, and if you want to search for it, I'm putting them all the Game of Thrones episodes on psychologyinseattle.com. So if you go to psychologyinseattle.com, there's a button under episodes, I believe, that says like Game of Thrones episodes, and so they're all going to be there, because if you just search for them on YouTube, it might be kind of hard to find them, or on your phone. But the point I'm making here is that when it comes to like evil characters like Ramsay Snow, people will email me and say like, oh, I love Ramsay. He's like sexy. And he's my favorite character. Well, no one ever says that about Alliser Thorne. Everyone hates that guy. And so when you hate someone, you just want to apply a mental disorder to them, right? You just have this kind of like, well, clearly there's something wrong with that guy. And there's also this massive misconception that if someone is being a dick, or if someone is presenting bad behavior, then they have to have some mental illness that causes that bad behavior. Someone goes on a killing spree, for instance, and kills a bunch of people. Well, it's hard for non-clinicians, it's hard for the public to accept that person might not have suffered from any mental illness. Some people will say, well, the fact that they did that, it means they have to have suffered from a mental illness. Well, I'm here to tell you, no. People make all sorts of weird decisions all the time. And I'm not saying going on a killing spree is good. I'm saying, in terms of morality and evil and social good, this is an extremely terrible, terrible act done by a human being. Is there something different about them? Is there a psychological reason for why they did what they did? Yeah, probably. But do they suffer from a mental illness as designated by the various mental illnesses in the Diagnostic Statistical Manual 5th edition? No, it's possible, but it's also possible they don't suffer. In fact, a lot of people who go on these killing sprees have, when people actually look at them, there's no evidence of any disorder at all. And so Alliser Thorne is someone that everyone hates, and he was massively insecure, and he was a total dick to Jon Snow. But honestly, he had his reasons, right? He wanted to uphold the rule of law and the rule of tradition, which is to keep the wildlings out of the Southlands, right? That's their mission. Their mission is to keep the wildlings, and Jon Snow was like wanting to bring all the wildlings over. And so, Alliser Thorne wasn't alone. He had compatriots who hated Jon Snow dead too. So there's reasons for it, and applying a disorder to him, I think, is short-sighted. Okay, next character. But before we do that, let's take a break. All right, we're back from the break. For those of you who are not a patron, become a patron now by going to patreon.com. That's patreon.com. Become a patron of the podcast, and you get access to hundreds of premium episodes, including one Game of Thrones episode that is only available to patrons, in which I analyze Sandor Clegane, the Hound. So go there, do that, become a patron of the podcast. Do it now. If you are a patron of the podcast, we love you so much because you are an awesome person, and you obviously have great tastes in podcasts. All right, Arya Stark. Let's talk about. So we've talked about Aerys the Mad King. We've talked about Alliser Thorne. Arya Stark. We're not even out of the A's, and we're already a half an hour into this podcast. My God, this is going to take forever, but it's so fun to talk about, All right, Arya Stark. Whatculture.com. Whatculture.com. A lot of people had a lot of things to say about Arya Stark. So, What Culture had a lot of things to say. Whatculture.com. What Culture said that Arya Stark suffers from PTSD, and the symptoms that they say are regular outbursts of anger, difficulty controlling her aggression and emotions, difficulty falling asleep. She has intrusive thoughts and dreams, and she maintains a hypervigilance to danger. All right. Well, let's look at PTSD. Let's look at the specific criteria for PTSD. All right. First criterion A is exposure to a threat. Was she exposed to a threat or to some kind of trauma? Yes, absolutely. She's been exposed to several horrible traumas. Okay, B, what is the second criteria? One or more of the following. Does she have intrusive, distressing memories? As PTSD often does. Does she have intrusive, distressing memories? No, I don't remember any evidence of her having essentially like flashbacks, right? Remembering something bad is not a flashback. It has to be intrusive and distressing. Like you're a war veteran from Afghanistan and you're walking down the street and you hear a loud noise and suddenly you're transported back to a moment where your friend got killed and there was blood everywhere and it's like just stuck in your head and you can't get, and it's very distressing. You have lots of anxiety. It feels horrible. There's no evidence that Arya had that experience. If you've seen that in the books, then let me know, but I didn't see. All right, 2, nightmares. Was there any evidence of nightmares? I don't remember. Maybe she did have nightmares, but I don't remember nightmares. Dissociation. No, I'm not even going to get into explaining dissociation. That's kind of like personality disorders. Dissociation is extremely difficult to explain to people, but no, I didn't see any evidence of dissociation. Psychological distress from triggers. No, I didn't see any. Does she have triggers? I didn't see any triggers to any kind of trauma, Physiological distress from triggers. No, I don't remember any evidence in the books of physiological distress. Physiological distress is like something reminds you of a traumatic event that you've been through and your body completely becomes dysregulated and you can't breathe or think or talk or function in those moments. And there's no evidence that she had physiological distress from triggers. Okay. Avoidance of triggers. There's no evidence of that. 2 or more of the following. Can't remember the trauma. No evidence of that. Low self-esteem. No evidence of that. In fact, she seems to have high self-esteem. As she's like 10 or 11 years old by the end of the 5th book, and she's out there killing people and joining the the no-face people, and she's for someone that's been through so much, I would say she has very high self-esteem. Self-blame, no evidence for that in an excessive manner. Persistent negative emotional state, no evidence of that. Diminished interest in things, no evidence of that. Feeling detached from others, maybe detachment from others. But she's around people who don't really care about her. I mean, think about the people that she's been around since King's Landing. There's really no one, even at King's Landing, right? I guess Eddard would have been the last person that she would have been around who, and that, the water dancer or the sword dancer guy, aside, what was his name? Like Curio, or these people were the last people she ever was with who actually cared about her. The Hound was, not super warm, right? And the no-face people, they're not warm at all. So the fact that she's detached from others might just be a product of the fact that she's just never been around someone that she could be close to. So if she were around, say, Jon Snow, maybe she would be really close, and so therefore she wouldn't meet this criteria. Can't experience positive emotions, maybe, but she seemingly had fun, with Sandor Clegane, so it's hard to say. So she might have met a couple of those, but again, not in a quintessential PTSD manner. 2 or more of the following. Irritable. No, I mean, she gets angry at times, but I wouldn't say she's like pathologically irritable. Reckless or self-destructive. You could kind of make a case for that, but she's on a mission, right? She wants revenge. She's highly motivated. So I wouldn't call it, the classic kind of self-destructive and reckless things one does is like in our modern society is driving too fast, or drinking and driving, or sexual behavior with people that you don't know very well, or spending money faster, just things like that. The things that Arya is on a mission, and she everything she's doing is heading in a particular direction, and she is succeeding. So I wouldn't say that's reckless or self-destructive. Is she hypervigilant? No. Again, with hypervigilant, it's sort of hard to explain what that means. This episode is already long, so I'm not going to explain it. But her, she's vigilant for sure. She's vigilant, but it's not hypervigilant. She's vigilant because she is being literally hunted and tried to be killed by people. Her vigilance is totally justified. So that's not what we're talking about in the DSM when we're talking about PTSD hypervigilance. The hypervigilance we're talking about in the PTSD DSM diagnosis is something that is not justified usually. Anyway, exaggerated startle response. I don't see any evidence of that. Problems concentrating. Definitely not. Sleep disturbance. Maybe a sleep disturbance. But again, we're not talking about a lot of endorsed criteria for PTSD. So in conclusion, she does not suffer from PTSD. If you know what PTSD looks like, Arya does not present those symptoms. Now, being affected by trauma, there's going to be a lot of soapboxes I'm going to get on right now. Just because you've been traumatized, as Arya has, she's been obviously traumatized. Just because you've been traumatized does not mean you develop PTSD. PTSD is a very specific reaction to trauma. There are many reactions to trauma, most of which are not in the DSM. Let me think if I can come up with a good analogy that involves the bone breaking thing. Okay, so let's say you're on your roof and you fall off your roof. Well, one of the possible results of falling off your roof is breaking the bone in your arm, right? But there's also a lot of other kinds of things that could happen to you that would be in addition to breaking your arm, or instead of breaking your arm. You could break your leg, or you could break your back, or you could have a brain hemorrhage, or you could sprain something, or you could have a contusion or a laceration, or what other kind of random medical terminology can I make up here? So when someone goes through a trauma, a psychological trauma, PTSD is but one reaction. And there are many reactions to trauma, most of which are not described in the DSM. And that's a problem, in my opinion. I think because the DSM is such a widely used instrument for understanding the human nature, which is a travesty, but because it's used as a way to understand human nature, it should include other kinds of traumatic reactions, because there's so many kinds. Anyway, getting back to whatculture.com says PTSD. I say no. Whatculture.com also says obsessive compulsive disorder, or OCD. And to this is one of my very first. So PTSD, when someone applies that to Arya, I'm just like, I can imagine clinicians who don't know what they're doing that. In fact, I have supervisees who will diagnose people with PTSD, and then I'm like, okay, so just tell me which criteria they meet. And they're like, well, they've been traumatized and they're kind of anxious. And I'm like, well, that PTSD is a very long disorder, has a lot of criteria. It's one of the longest lists of criteria in the DSM. And you can't just say they were traumatized and they're anxious. That's not enough to justify a label of PTSD. You're going to have to go back to the client and assess that person if that's what you want to do. So clinicians will do this, especially novice clinicians. But when it comes to OCD, I feel like most people understand what that is. And in this article, they're basically saying, well, because she has this obsessive death list that she says every night before she falls asleep, that justifies OCD. And I just have to say, like, that is just the dumbest thing I've ever heard. Well, I've heard a lot of dumb things. It's one of the dumbest things I've ever heard. Obsessions, let me explain what obsessions are. Obsessions are, this is DSM language, recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted, and that in most individuals cause distress, and the individual attempts to ignore or suppress those thoughts and urges or images. So again, recurrent and persistent thoughts, urges, or images that are experienced as intrusive and unwanted. So as she goes to bed at night, when she is reciting her death list, is that a intrusive thought? No. Is that an intrusive or unwanted urge? No. She wants that urge. It's justified. These people have done horrible things to her, and she has reasons to get revenge. In fact, I would say most of us reading the books and watching the TV show are hoping that Arya actually succeeds in doing this sort of thing. So in some ways, it's a justifiable revenge motivation. How is that related to OCD? Like, if you woke up in the morning and said, today I'm going to have a good day, and every day you said that, or every night before you went to bed, you thanked God for all the good things that are happening in your life. Is that OCD? No, that's just something you do before you go to bed. It's stupid that someone would think that's OCD. It's just dumb. Okay, the next label that whatculture.com says is codependent with the Hound. So they think that Arya Stark is codependent with the Hound. Okay, another stupid thing. Codependent is not a diagnosis. So why are they presenting it as such? I think if they're trying to use a diagnosis, they would want to use dependent personality disorder. Codependent is a word from Alcoholics Anonymous that usually refers to the spouse of a dependent person, hence the word codependent, as in co-pilot. So you have you have someone who's dependent on alcohol, and the spouse is the codependent, like co-pilot. Just because Arya Stark found a friend, they have to pathologize that. But we all need people. Imagine that you're 10 years old and everyone is out to kill you. Wouldn't you latch on to anyone who was at least partially on your side like the Hound was? This is just another example of how Westerners pathologize healthy attachment. Arya is reaching out to someone who is literally going to save her life and bring her back to her family. And she kind of likes the guy. And so how do you call that fucking codependent? It's so dumb. Okay. Whatculture.com continuing to diagnose Arya Stark. Dissociative identity disorder, otherwise known as, in the past, multiple personality disorder. Quote, let's not even get into dissociative identity disorder thing in her latest storyline with the faceless men, unquote. Okay, just more stupidity here. Let's look at the criteria for dissociative identity disorder. Disruption of identity by two or more distinct personality states with discontinuity and sense of self. Does she have that? No. Does she have recurrent gaps of memory? No. Does she have significant distress from these memory gaps or from disruption of identity? No. Dissociative identity, similar to personality disorders, similar to just general dissociation, is extremely difficult for me to explain, and probably best. Well, actually, I do have another podcast episode in which we talk about. Actually, there's two episodes. One in which we talk about dissociative identity disorder in the movie Split, and one in which we talk about dissociative identity disorder in the movie Fight Club. So go out and listen to those if you want to. But dissociative identity disorder is it's a legit thing that happens to people. And to call Arya Stark as suffering from dissociative identity disorder because she disguises herself as different people is just the dumbest thing I've ever heard. I mean, my God, people. Okay, MTV.com thinks that she has PTSD because she's stuck in survival mode. And this, so the MTV quotes her from, the MTV actually reached out to an actual clinician, I think a mental health counselor and a licensed mental health counselor, and actually provide. I'm not going to call out these people's names because I don't see the point in that, but MTV quotes, just remember, actual clinician. Being stuck, PTSD because she's stuck in survival mode. She's reciting that list. She's replaying all those traumas that have happened to her. Her brain isn't being rational. It's stuck in an emotional hemisphere. What the frick does that mean? It's all anger and fear all the time. Okay, so that's what they're saying. Again, just because someone has been through a trauma and just because they're angry, that doesn't mean they have PTSD. It's just the stupidest thing. I mean, my God, people, they encounter a trauma and they get angry. That means they have PTSD. That's just so stupid. What you remember all the criteria that I listed off, and I'm just going to rattle them off really fast. Intrusive distressing memories like flashbacks, nightmares, dissociation, psychological distress from triggers, physiological distress from triggers, avoidance of triggers, can't remember the trauma, low self-esteem, self-blame, persistent negative emotional states, diminished interest in things, feeling detached from others, can't experience positive emotions, irritability, reckless, self-destructive, hypervigilance, exaggerated startle response, problems concentrating, sleep disturbances. Now, you don't have to meet all those criteria, but you have to meet a number of them. And she doesn't have any of those things. She's been through a trauma and she's angry and therefore she has PTSD. Hey, good boy. Okay. A Blog of Thrones. What do they say? Okay, get this. A Blog of Thrones. A Blog of Thrones says that Arya Stark has schizophrenia / multiple personality disorder. In the article, they're saying that schizophrenia and multiple personality disorder are the same thing. Quote, Arya Stark's struggle with her own identity versus the one the faceless man want her to take creates this personality conflict within her. Unquote. My God. Dumb. Idiots. These are completely different disorders, one. Two, we don't use the term multiple personality disorder anymore, but I'll forgive that. It's fine. You can utilize that term. I still use Munchausen by proxy because I like it. It's now called factitious disorder imposed on another. But anyway, so a blog of Thrones thinks that schizophrenia and multiple personality disorder are the same thing. They're not, one. And two, she doesn't suffer from either one of those things because they're extremely specific disorders. And I just wonder what this author did. Did they just go on Wikipedia and just glance at the criteria and go yeah, it looks about right, It'd be like be like me as a non-physician, like someone's kind of sick and they're sniffling. I'm like, I go on the internet and I'm like, yeah, it looks like HIV. You have HIV. It's like, oh, okay. So again, what do I say Arya has? I would say she has nothing. She doesn't suffer from any mental disorder at all. She is actually highly adaptive to her situation. She is actually quite resilient to the traumas that she's been through. She is she gets disheartened at times, and she gets angry at times, and she is suffering at times. But that's life. That's grief. That's reacting to life. If someone steps on your toe and you get angry, is that a mental illness that you have? No, you're getting angry because someone stepped on your toe. It's normal life. You don't have to pathologize that. And Arya Stark, in my opinion, does not suffer from schizophrenia. My God, how stupid. She doesn't suffer from multiple personality disorder, PTSD, dissociative identity disorder, codependency, which isn't a thing, obsessive compulsive disorder. My God, no, she doesn't suffer from any of these things. She's got a clean bill of mental health. Now, is she a healthy individual? Is she living a healthy life? That is debatable. Does she have issues? Clearly. That girl is going to need therapy for a long time after this is all over. But that doesn't mean she has a mental illness. I guess you could make the argument she has an adjustment disorder, maybe. I guess a lot of these people you could, because adjustment disorders kind of have low criteria at times, depending on your point of view, but I'm going to not go down that road. Okay. Next character, Bran Stark. Bran, Bran, good old Bran. There goes a very loud motorcycle that annoys me outside my window. Okay, Bran Stark. A blogothrones.com says, psychoticism, quote, a generic psychiatric term in which a person starts losing contact with reality. Bran is training to have visions through the weirwood trees with the three-eyed raven, unquote. So psychoticism is what a blog of Thrones says Bran Stark is suffering from. Just stupid beyond belief. The term psychoticism has a number of different old definitions, and most people don't even use this term anymore. So given the track record of Blog of Thrones has presented so far, I'm really trying to figure out where they even got that term from. I would guess that most clinicians don't even know what psychoticism means or have never even heard it before. One definition of psychoticism is psychopathic traits to some degree, even small, or like a degree of psychopathy. And Bran is definitely not psychopathic. He's one of the most empathetic, caring people in Westeros. But what I think a Blog of Thrones meant was psychotic. They confused psychotic or psychosis with psychoticism, since they said that he's quote unquote losing touch with reality, losing contact with reality. This is additionally stupid. He's actually tapping into his powers, which helps him to see far away and across time. He's not psychotic. He literally has magical powers. So how is he losing touch with reality when this is a magical world and they have magical things? If Bran came to one, they live on some other planet, literally. So if Bran somehow transported himself to our galaxy and came to one of our mental hospitals and reported that he could see through time and he could meld with a tree and blah blah blah, yeah, people would think potential psychosis. But he has those powers, so he doesn't have that issue. So, in conclusion, Bran Stark, no diagnosis. Don't be stupid. Okay, Brienne of Tarth. Brienne of Tarth. Oh boy, let's get into this one. A Blog of Thrones says masculinity complex / tomboyism. Masculinity complex / tomboyism. Quote, or as Sigmund Freud worded it, penis envy. When a girl dresses and behaves like a boy to find significance in her life, unquote. This is stupid too, but there is actually some merit to what they're saying if they are utilizing some definitions of classical Freudian talk. So, but again, there's no DSM diagnosis. I think a Blog of Thrones, even on their website, they were talking about how these were actually medical conditions. I don't even think they were referring to them as mental health issues. So there's that. So if we're looking at Brienne as as having a mental illness called masculinity complex or tomboyism, then that's completely stupid. But if we're looking at Brienne and saying she's got issues, like she has a complex with gender, she is a tomboy, and she has penis envy, then let's get into that. So first off, penis envy is not dressing up as a boy. That's not what that means. It's way more complicated than that. I'm not super into the psychosexual stages of classic psychoanalysis, so I couldn't even go on for a long time about it if I wanted to. But the bit I do know about it, it's not just simply dressing up as a boy. Plus, almost no one uses the construct of penis envy, even psychoanalysts anymore. And I'm a psychodynamic person, and so penis envy, it just isn't used anymore. But if you wanted to use that, then and you your write-up on blogofthrones.com is not sufficient to convince me that you understand what penis envy is. But if you provided one, I'd be open to reading that. Let's move on to masculinity complex. I've never even heard of this before. I've heard of masculinity and femininity inferiority complex, which refers to women who so femininity inferiority complex is, an obvious term that refers to when women become masculine because they have been made to feel as though femininity is inferior. So does she have a masculinity complex? Yeah, maybe, or does she have a femininity inferiority complex? Yeah. I mean, you could make an argument for that. Tomboyism, I'd never even heard that term before. I looked it up. It actually is kind of a term that some people use. Again, not a disorder, as any of these things are. It's not a mental illness to dress and act like a culturally different gender than you are, or what people say you are. And so I don't know why we have to label someone as a tomboy. As a child, she tried to conform to female norms. As a child, she was actually very much trying to be a proper lady. She was ridiculed, though, because everyone thought she was too tall and too ugly. In the books, they describe her as much more ugly as they portray her on the TV show. In the TV show, she's actually attractive. Gwendolyn Christie is she's a pretty lady. But in the books, in fact, when I saw the actress who was going to play Brienne, I was like, oh no. I mean, she's tall and she seems fierce, but she's not ugly enough. I mean, the vision I had in my mind when I was reading the books, I was like, boy, this woman must be, pretty ugly. And I think, if they cast a uglier character, I think it would have been more compelling. But of course, it's a TV show, and so in the same way that Theon Greyjoy in the books, after being tortured, is a disgusting human being. I mean, he's lost most of his teeth, lost most of his fingers, most of his toes. His hair has gone white. He's lost 30 pounds. He doesn't walk right. He doesn't look right. He looks 40 years older. Well, in the TV show, he looks exactly the same because if you deformed him, it'd be hard to look at him, And so TV shows usually do that. But anyway, so as a child, she tried to conform to female norms, but everyone made fun of her because she was ugly and tall. So she started to fight people, and she found that she was good at fighting people. And so she tried to fight in tournaments and stuff, and she was good. So she stuck with that, and she became perhaps the best knight in all of Westeros. So that's her progression into that. It has nothing to do with her psychology or, any mental illness or what we might call tomboyism or something. It's just, she deep down probably wants to fit into society, but they didn't let her fit in. So she decided to do something else, Now, some might say that she has gender dysphoria, which is in the DSM-5, but if you know what that looks like, you know that she doesn't have gender dysphoria. She's a heterosexual, cisgender woman who decided to become a knight because that gave her self-esteem because everyone was making fun of how tall and ugly she was. It'd be like if a woman decided to join the NFL and she was one of the best linebackers in the league. Is that a mental illness? No. Is that gender dysphoria? No. Is it tomboyism or a femininity inferiority complex? I wouldn't say. Is it penis envy? I mean, I don't know why we have to apply any of these labels to it. So in conclusion, Brienne does not have any evidence of mental illness. She's been traumatized a lot, being bullied and whatnot. Does she have issues? Does she have self-esteem issues? Does she have, I don't know, self-worth issues? Maybe, but that's not mental illness. All of us have self-esteem issues to some extent. All right, let's take a break, and when we get back, let's go to Cersei Lannister. My God, this episode's going to take forever. I'm only on the letter C. Oh my God, let's take a break. Okay, we're back from the break, and we're going to talk about Cersei. We're only on the letter C, and this episode, I have now decided, is probably going to take 5 hours. So, oh boy, I hate doing part episodes. I don't know why. I hate doing episodes in parts because, when you find part 2 and you're like, wait, where's part 1? I don't like that as a consumer of podcasts. I'd rather just have it all in one file, I guess. And so I've always done just one files. Anyway, also, before talking about Cersei Lannister, again, become a patron. Please go to patreon.com. Support the podcast. Support art. Support your stuff. I'm not calling this art, by the way, but a lot of people are doing art on Patreon. But support podcasts, I do this. It takes me hours and hours and hours to, especially for an episode like this, to prep. And so the only reason why I'm doing this, and the only reason why I'm dedicating all this time is because about 500 of you or 400 of you have become patrons of this podcast. And so that justifies me taking time away from my practice, essentially, to dedicate all of this time to you. All right, Cersei Lannister, whatculture.com. Let's see what they say. Whatculture.com says about Cersei. Narcissistic personality disorder with Machiavellian tendencies. They write, it's a textbook case of narcissistic personality disorder. She is almost completely consumed by a pathological need for power, success, and status, and has precisely zero problem stepping on whomever she needs to in order to get it. She has a complete lack of empathy. She is cruel, self-obsessed, controlling, haughty, power-hungry, exploitative, and ruthless. Okay, so let's look into this. What do I say? Well, sort of. But I would say not really. But, one could make the argument for narcissistic personality disorder. But let's look at the criteria here. A grandiose sense of self-importance. Again, as I said earlier, when we talk about personality disorders, these are hard things for clinicians to understand, let alone someone who's looking it up on the internet or listening to a podcast about it. So what differentiates grandiose sense of self-importance from, someone who does not have narcissistic personality disorders to someone who does? This is a very difficult thing to describe and understand. But does Cersei Lannister have a grandiose sense of self-importance, like exaggerating achievements, exaggerating talents? I invented the internet, for instance. That's one exaggerated achievement. You did not invent the internet. Or expects to be recognized as superior without the commensurate achievements. So, I don't know. Let's see, you're not a very fast runner, but you expect people to think of you as the fastest runner on the planet. Okay, that's there's something wrong with you if that's how it is. Does Cersei exhibit this behavior? No, she is the effing queen of Westeros. The society worships her, and she doesn't exaggerate anything. So She has no grandiose sense that she is self-important. She's the queen. So, and before she was the queen, she was a princess or a lady or whatever they call it, in the house Lannister. She was, a daughter of Tywin Lannister, one of the most powerful men in the known world. So does she have a grandiose sense of self-importance? No, she's queen. Everyone says she's important. She does have importance. Okay, number 2, preoccupied with fantasies of unlimited success, power, brilliance, beauty, or ideal love. Again, in my opinion, we're talking about Eye of the Beholder, but no, she doesn't meet this criteria. Again, she's the effing queen of Westeros. She already has power. She didn't want any more power than that. Everything started to go downhill for her when she was forced to marry Robert, who didn't even like her. And he also beat her. So she turned to Jaime for comfort. And they had 3 kids, maybe by accident, I'm not sure. And when Jon Arryn and Eddard threatened to out her secrets, which would have resulted in her death and the death of her children, because King Robert would have killed her and killed the children. When Jon Arryn and Eddard Stark threatened to out her, she did what she at least considered what people would consider to do, which is to kill Jon Arryn and kill Eddard Stark, which is what she did to protect herself. She was ruthless, and she exhibited several degrees of lack of empathy and remorse. But if you understand her circumstances, you see that her back was up against the wall. Now, later, she kills all those people with wildfire, not in the books, but in the TV show. But again, she was facing the likelihood of imprisonment or death. Again, her back was up against the wall. If anything, she has antisocial personality disorder because she doesn't seem to care about the people that she harms. But in my opinion, she's just trying to preserve her own life and the lives of her children, which is what everyone would do, and particularly in this world. I mean, this world is a brutal, ruthless place, and a lot of people in her shoes would have done the same. So does this mean she has narcissistic personality disorder? In my opinion, no. Although a lot of people thought she had narcissistic personality disorder. If you want to call her narcissistic, then fine. If you want to call her mean and unkind and self-centered, then fine. But that's not narcissistic personality disorder. Although you could argue that she had traits of narcissistic personality disorder because she lacked empathy, she was arrogant, she did look down on other people, and she did consider Jaime to be the only one worthy of her love. And in the books, he looks exactly like her. When they were kids, no one could tell the difference between them. So she's, self-centered enough that she only thinks that Jaime is worthy of her love. Although she did actually love Robert before he became a dick to her. You could make the argument for narcissism. You could even make the argument for narcissistic personality. But honestly, when you clinically encounter people with narcissistic personality disorder, they don't present the way Cersei does. And again, that's just one of those things you're just going to have to believe me on, because again, personality disorders are extremely complex and hard to describe. I guarantee you've probably run across someone with narcissistic personality disorder, but you probably didn't know that that's what it was. It's a very particular presentation. Maybe I'll do an episode on that. In fact, I know I will at some point because it's a hot topic in today's media. All right, let's see what MTV.com says about Cersei Lannister. Again, actual clinician being interviewed. The clinician diagnosed her with borderline, not borderline personality disorder, just the word borderline. She over-identifies with her children. This is what they're saying. She over-identifies with her children, especially Joffrey, and is complicit in helping him stay in power because it helps her stay important. But you can see it most clearly in her relationship with Jaime. It's an I hate you, don't leave me. They push-pull back and forth, and of course, their sexual relationship. Borderlines gravitate toward risky behavior, anything that releases endorphins. Risky sex, gambling, drugs. The brain registers these things as solutions rather than risks. End of quote. What would I say about borderline? Maybe. But if you understand the history of Cersei, you would know that her reasons for being like this is there are reasons. You should listen to my long episode in which I did, a couple hours on Cersei. She was very close to Jaime for some very justifiable reasons. Also, she wasn't overly emotional when betrayed. She never decompensated. She gets revenge like the way Arya does, but that's not borderline. Getting revenge, isn't necessarily borderline. When people with borderline personality disorder, when they're betrayed, they become emotionally unhinged because they've been traumatized. Remember how I said you fall off a roof? There's a lot of different diagnoses that can happen. Well, when you become traumatized, one of the things that can happen is you can develop borderline personality disorder. So, and I consider it at its base a traumatic reaction. And so when you are rejected, even the hint of a possible rejection as an adult, it triggers those deep childhood traumas regarding being rejected and abandoned or abused as a child over time. And you start to re-experience all those feelings of just being empty and alone and not good enough and angry and hurt and afraid and just all those things. And then you decompensate emotionally, and your personality becomes unhinged, and you become extremely emotionally erratic and upset, and you might get angry and stuff. Cersei never did that. There was no decompensation from Cersei. She was very calm and cool and collected. Well, having borderline personality disorder is not typically associated with being calm and cool and collected. It's really the opposite. So again, borderline personality disorder doesn't really fit the bill. But in the books, she is much more paranoid than she exhibits in the TV show, particularly when Tommen was king. She's totally convinced that many people are out to betray her, which is, it's a minor sign of borderline personality. But really, if you have any experience with borderline, you would know that she doesn't fit the profile. So MTV.com, borderline, conclusion, stupid. So what's the final? Oh no, there's a couple other. There's another website here, a Blog of Thrones. What does the Blog of Thrones say? They say alcoholism, because of excessive and compulsive drinking that leads to psychological and physical addiction. Unquote. That's sort of old language, but the psychological and physical addiction bit, but it's fine. Also, it's not called alcoholism in the DSM. It's called alcohol use disorder. But we don't really know if she was actually addicted. It's hard to say. But I'll get more into that in a second, I think. So in conclusion about Cersei suffers from antisocial personality disorder, or what we might call, that's not in the DSM, psychopathic personality disorder. However, her diagnostic presentation is complicated by the fact that she's a woman who has been continually marginalized and abused, most notably by her father and her husband, and kind of by society. Also, she is surrounded by a context that values power, specifically royal power. So her psychopathic antisocial behavior could be a result of circumstances and culture rather than her personality. Most of her major antisocial acts have been instrumental in gaining power and could be considered acts of survival from her perspective. She also suffered from alcohol use disorder, since she appeared to drink every day, throughout the day, but it's hard to say if she had any ill effects from her drinking, which is a criterion for the disorder of alcohol use disorder. But that's really common to fictional depictions of alcohol use. They rarely show any negative effects. People like Tyrion is there. One time they showed a negative effect is when he vomited. That one time when he landed in, across the narrow sea, Bravosi, I think they were in. Anyway, the rest of the time they just never show any ill effects. Tyrion and Cersei are drinking wine all the time, and they seem to get a little bit more lush. They seem to get a little bit more bold, and and cynical when they drink, which, might be something that people do when they drink. But in the movies, they rarely show like the reality of alcoholism, that it actually produces. Slurred speech, bad choices, difficulty thinking, massive hangovers, just compulsive drinking in the face of consequences, not making any sense, losing your temper. There's a lot of things that you see in the real world with persistent alcohol use that you just don't see in depictions, in fictional depictions, probably because it's just not fun to see that, I guess. I don't know. The way they portray drinking in the movies and TV shows, it always just seems so glamorous. It's like, oh, that sounds fun. I'm going to be Tyrion, and I'm going to be, king of wine, or what does he call himself? King of wine and tits or something. So getting back to Cersei, some might label Cersei as suffering from borderline or narcissistic personality disorder or some other personality disorder. But in my opinion, she is, for the most part, below the threshold that is required for those labels. So in conclusion, Cersei, there's really not any evidence, not enough evidence for any mental disorder. Antisocial, borderline, narcissistic personality traits, but not the full disorders. She certainly exhibited a lack of empathy and harm to other people. She exhibited some sensitivity to rejection and some push-pull with Jaime. She exhibits some self-centeredness, but she, in my opinion, does not fit the full criteria for those disorders. Again, it's particularly the one you could say is antisocial, but again, when you look at her specific choices, and I didn't go through the books again, but from my memory in the books and her decisions, she made a lot of decisions that made sense to her survival, and again, sometimes she was being threatened with death, or at the very least, a life of servitude or being a poor person somewhere, So, I wouldn't say she has any sort of personality disorder. Does she have alcohol use disorder? Probably, but the books just don't give us enough data to make that decision. Could she stop at any time? Does she actually drink all day, every day? Is it presenting any negative effects for her? It's just, they don't give us enough data. So in conclusion, Cersei, no diagnosis, but antisocial, borderline, narcissistic traits, and a very good possibility for alcohol use disorder. Okay, let's go on to Daenerys. Finally at the letter D. How long is this episode going to take? WhatCulture.com says that Daenerys is sane. They say, despite her gene pool being as shallow as a bird bath, I like that line, she is as well adjusted as you could hope for a woman who has been sold by her brother, gave birth to a deformed dead baby, and owns a trio of dragons. As a powerful queen, she is inevitably a bit forceful, but not mentally ill. MTV also said she's sane. She's not narcissistic, and she's very empathic, they say. Psychology Today also gives no diagnosis to Daenerys. They say, she's one of the most stable, well-adjusted characters in the Game of Thrones universe. She isn't overly anxious, doesn't have multiple personalities, and doesn't suffer too much from her past trauma. So I have a confession to make. Try as I might, the DSM-5 doesn't give me anything to work with. I find that, so unquote, I find that line is sort of telling, right? So Psychology Today, presumably a clinician, is writing this one. I'm pretty sure on that. And this writer, they say, try as I might, I can't diagnose Daenerys with anything. I find that interesting. Try as I might. Why are you trying so hard to diagnose? I think that's one of the things about these websites. It's like you ask someone, okay, what mental illness does Daenerys suffer from? Like there's this compulsion to like just come up with something. How about be a clinician and say it's fine. She doesn't have anything, like why do you have to do that? If anything, you should be extremely conservative when doling out complicated labels like, personality disorders. So what's my opinion? Yeah, I agree. There's no evidence of mental illness. I suspect that everyone is being very careful about diagnosing Daenerys because they like her. And because she just doesn't show any of the kind of triggers that would cause people to diagnose. But I find it interesting that no one on the internet that I was looking at, all these various sites, that no one is discussing that she might have narcissistic personality. If Cersei and Alliser are so clearly narcissistic to people, then why not Daenerys? Daenerys is just as power hungry as Cersei, if not more. Daenerys kills a lot of people to gain power. Now, she also frees a lot of slaves, does a lot of what we would consider to be morally good things. But, she's killed a lot of people, all because she wants to rule Westeros. She is hell-bent on killing people so that she can go back to Westeros to kill a bunch more people so that she can sit, because she wants to sit in the Iron Throne, because she deserves it. And that no one is talking about narcissism in that. I mean, I wouldn't say she's narcissistic, but with all the loose talk on the internet about narcissism, why is there zero talk about Daenerys being narcissistic? It's just interesting. I think it's because people like her, and and again, it shows that when you don't like someone, you want to diagnose them. All right, Grandmaester Pycelle. He is the sort of asshole maester. A blog of Thrones says malingerer, quote, a person that fakes illness or exaggerates symptoms for personal gain or to avoid work and duty, unquote. What would I say? Yes, he is malingering, but malingerer is not a diagnosis. The term in the DSM is factitious disorder imposed on the self. And as I was preparing to talk about Grandmaester Pycelle, I realized that I screwed up the Munchausen by proxy episode in which I talked about Munchausen by proxy, and I also talked about that documentary Mommy, Dead, and Dearest, because I kept saying factitious disorder imposed by another, and I didn't like that. And I think I even said once, I was like, why isn't it called imposed on another? And it is imposed on another because, of course, it's called that because that's what makes sense. And I'm an idiot because I kept railing on a name that I didn't realize it was. I was guilty of one of the things that I am blasting people for, which is not accurately reading the DSM, and I just want to face palm and do that Napoleon Dynamite line. Idiot or idiot, anyway. But yeah, so the technical term DSM, factitious disorder imposed on the self, Grandmaester Pycelle. But he doesn't seem to have factitious disorder because he's not presenting as such. And if you want to know more, listen to my Munchausen by proxy episode for more information about that. It's just because you're faking an illness doesn't mean that you qualify for factitious. Factitious is kind of a specific thing. Factitious is usually reserved for people who are doing it compulsively and strangely, and there's not really any right. They might get some gain from it, but doesn't really make a lot of sense as to why they do it. Grandmaester Pycelle acts like he is old and rickety because I think he wants to manipulate other people to go easy on him. Think of him as this frail, simple old man, and therefore worthy of other people's compassion. And at least that's what I think. And there's some things I could be getting the books and TV shows mixed up on. I know that they portray this in the TV show, but and I'm pretty sure they portray it in the book too. But anyway. So diagnosis for a Grandmaester Pycelle, there's no evidence for any mental illness, but is he faking an illness, aka malingering? We would say yes. Sir Gregor Clegane, the Mountain, a blog of Thrones calls him sadism, a person who enjoys inflicting pain on others. And what do I say? Yes, a blog of Thrones, you are correct, sadism. We know that he was abusive to his little brother, Sandor Clegane, the Hound, And he and his men repeated. So this is in the books, by the way. So in the TV show, they don't show this, but at least I don't think they did. But in the books, he and his men, the Mountain Men, I think they were called, he and his men repeatedly and brutally raped several innocent girls and women in the books, which is, again, not depicted in the TV show. And he killed Prince Rhaegar and his baby by dashing the baby's head against the wall. And it's rumored that he killed his father, and it's rumored that he killed his first 2 wives, and it's rumored that he killed many of his servants. And he didn't seem to have any hesitation or remorse about these actions. So I would say definitely the label of antisocial personality disorder would be justified. Sadistic personality disorder, which is not in the DSM, would also be justified. And sexual sadism disorder would also be justified. Sexual sadism disorder, which is one of the paraphilias. But again, it's hard to tell if he's just following orders and purposely being scary, because that's part of his job, is to be scary and violent. But I think given what we understand about, at least if the rumors are true, then, and even some of the things that we absolutely know. I mean, randomly finding little girls, like 13-year-old girls and young women, and just gang raping them, that's sick. It's disturbed behavior, definitely antisocial, definitely sadistic, and definitely sexual sadistic. The Mountain is he's one of the worst people in the books, up there with Ramsay. He is a horrible, horrible human being. All right, Jaime Lannister. A lot of people have opinions about what he is suffering from. WhatCulture.com claims him to be sane. Again, we don't use the term sane or insane. That's there's some legal terms about sanity, but that's not a term we tend to use in mental health. We would say that he doesn't meet criteria for any mental illness or a diagnosis in the DSM. So What Culture says no diagnosis. MTV.com says narcissist, and doesn't really provide any justification. They just say he comes from a family of narcissists. Blogathrones.com, narcissism. When a person has an inflated sense of their own importance and complete disregard towards others, often seeing them as inferior to them. Okay, what do I say about Jaime Lannister? Well, these other websites, MTV.com, blogathrones.com, they're not saying narcissistic personality disorder. They're not using that entire phrase. They're just saying narcissist or narcissism. So it's fine for them to use those terms since they're not technical diagnoses. Anyone can call someone narcissistic, for instance, if that's what they think makes sense to them. But and I, as a clinician, am not going to wag my finger at that, because that's not a technical term, and there's no clear standardized definition of what that means. So anyone can do that. It's like calling someone a jerk. You're a jerk. Well, as a diagnostician, I'm not going to say, what's the criteria for jerk? It's just like, fine, it's a word, whatever. So these websites are claiming to be diagnosing, and they're just saying narcissist. I'm going to diagnose him as a narcissist. so my God, it's so dumb. But does he have narcissistic personality disorder, which I think is what these people are trying to say. Again, context is everything. He was raised in a society that worshiped him. So when he exhibits his self-importance, he's just doing what society taught him to do and what society kind of wants him to do. Also, he wasn't obsessed with bragging about himself and making everyone admire him. So at least from my memory from the books, he wasn't like super obsessed with making everyone admire him all the time. So, and again, if you understand actual presentations, full-blown narcissistic personality disorder, you know that Jaime Lannister does not fit those criteria. Is he self-centered like Cersei? Yeah. Would we all like him, particularly in the beginning of the books, to take it down a notch? For sure. Would we all like him to have empathy? Absolutely. But, he's raised in a world and in a family and in a context in which, there's the people who matter and there's the people who don't. And he was just following those protocols. In some ways, you could say that he was quite noble and chivalrous when he decided to kill the Mad King, But anyway, so in conclusion, I would say Jaime Lannister, no evidence of mental disorder. Let's not overdiagnose everybody. All right, let's take a break, and when we get back, we'll get to the letter. We'll continue with the letter J. Okay, we're back from the break, continuing after talking about Jaime Lannister. Let's talk about Jaqen H'ghar. ThoughtCatalog.com. This is a new player in our field here. ThoughtCatalog.com. They say Jaqen H'ghar has dissociative identity disorder. And this site actually provides treatment plans. Treatment plan, 25 appointments with a psychologist, allowing multiple identities to be consolidated, they said. Okay. To you clinicians out there, I just want to read this because it's so dumb. Okay. So thoughtcatalog.com diagnoses Jaqen H'ghar with dissociative identity disorder and a treatment plan of 25 appointments with a psychologist, allowing multiple identities to be consolidated. Again, this episode is already too long. I'm not going to go into dissociative identity disorder that much, but and treatment plans. But I just have to say, like, my God, that's so stupid. 25 appointments is way not enough for dissociative identity disorder if you truly thought someone had that. And then the 25 appointments with a psychologist. Well, what about all the other mental health professionals who are qualified to treat dissociative identity disorder? And then just applying the label dissociative identity disorder to Jaqen H'ghar, just dumb, just stupid. Okay, Joffrey Baratheon. Whatculture.com. What does whatculture.com have to say about Joffrey Baratheon? They say sociopath with sadistic tendencies. They say Joffrey is completely devoid of empathy and takes active enjoyment in the violation and harm of others. Well, what do I say? Well, sociopath is not a preferred term. People don't use the term in the mental health world. Antisocial personality disorder is used, and sometimes people use psychopathy or psychopathic personality disorder. But yes, if whatculture.com is saying antisocial with sadism, absolutely. Joffrey Baratheon is super antisocial and super sadistic. But we wouldn't apply that label because he's not 18. I think he dies at the age of 13. And so in the field, we would label him as conduct disorder because that's the childhood version of antisocial for the most part. A blogothrones.com, they say antisocial personality disorder. So whatculture.com and a blogothrones.com, they get it right. MTV.com, what do they say? The clinical sociopath, they say. Clinical sociopath. I love it when people use the term clinical as if other diagnoses are unclinical, like clinical depression. It just shows that they're ignorant of our lingo. MTV.com, the clinical sociopath. So not only are they using that stupid term clinical, but they're also using the term sociopath. It's like, whatever. But, in essence, they're right. So Psychology Today says antisocial personality disorder. But realistically, Joffrey would have been diagnosed with conduct disorder. So Psychology Today was the most accurate, although they weren't always accurate. What would I say? Yeah, Joffrey suffered from antisocial personality disorder as well as sadistic personality disorder, which is not in the DSM-5. Specifically, tyrannical sadism, in that he relished in verbally and physically harming and abusing others with his power. However, since personality disorders are commonly relegated to only adults and not minors, most current clinicians would apply the label of conduct disorder because he exhibited a pattern of violating the rights of others as a young person. His disorder may have developed from the abuse that he experienced from his father, Robert Baratheon. He also had a distant mother. I'm guessing, we could imagine Cersei wasn't all that close and warm. Joffrey also experienced trauma from his parents fighting all the time. It's something, obviously, they didn't show in the TV show, but they refer to it in the books that, Joffrey experienced as a young child. his parent, Robert Baratheon and Cersei were fighting all the time, and it was violent. It got ugly, and Robert was very violent with Cersei. Also, that something that's not really portrayed in the TV show is Joffrey looked like a girl, and he was being teased because he looked like a girl. Also, inbreeding might have an effect on the development of sadism and antisocial. Also, his mother drank while she was pregnant in all likelihood, and that might have had an effect. There's not a ton of solid research on that, but you never know. Also, growing up, he was heir to the throne of Westeros, and he's being told he's better than other people. And, we know real cases where children are spoiled in this way and can develop antisocial, at least traits. Also, we can imagine that his parenting conditions weren't also great. So there are a lot of reasons why Joffrey developed his issues, his conduct disorder, which makes me believe that if given enough time and enough love and enough attention and enough good environment, he could have pulled himself out of it. It's just a guess, but who knows? Ramsay, on the other hand, in the mountain, they're far gone. There's nothing that could be done. So in conclusion, Joffrey Baratheon, antisocial personality disorder, sadistic personality disorder, and sexual sadism disorder. And if you want to hear my full analysis, listen to the full episode on Joffrey Baratheon. That was my very first Game of Thrones episode. I don't know why I did it, but I just wanted to do Joffrey. And as soon as I posted it, everyone was like, oh, you got to do Ramsay and you got to do this person. And so this episode is kind of in response to everyone wanting me to do all the all the characters. Okay, Jon Snow. Let's go to Jon Snow. WhatCulture.com says seasonal affective disorder. And let me quote them here. Depression runs in Jon's family with a strong tendency for melancholy running through the Stark DNA. He has a depressive affect, and it's only been getting worse since heading north. Seasonal affective disorder is a type of depression that worsens during the winter months with reduced sunlight and colder weather. Early on, he can be found laughing and joking with his family in the comparatively temperate environment of Winterfell, but as winter draws in and the nights get darker, so does his outlook, unquote. All right, what do I say? This is stupid. There's no evidence of this disorder. The technical term is major depressive disorder with seasonal pattern, and let's go over the criteria here. Okay, first off, for major depression, a depressed mood, meaning feeling sad, feeling empty, feeling hopeless, appearing like you're down. There's no evidence that Jon Snow had a depressed mood. Diminished interest and pleasure in things that you were normally interested in. No, he is highly motivated in his work. He is one of the most non-depressed people in the books. I mean, look at all the things he does. Depressed people have a hard time getting out of bed in the morning, let alone taking on the world the way Jon Snow is. So no, he is definitely interested in getting his job done and saving the world. So I wouldn't say he has diminished interest. If anything, he has an increased interest in taking action on things. Weight change. There's no evidence of that. Sleep problems. I don't see any evidence of that. Psychomotor agitation or retardation. Absolutely no evidence of that. Fatigue. I don't see any evidence of that. Feelings of worthlessness. No evidence. Difficulty concentrating. No evidence. Suicidality. Actual suicidality, not, the kind of stuff that you just do in the course of war. No evidence of wanting to kill himself. Significant distress from all these things. No. Okay. Seasonal pattern. Depressive episodes that coincide with seasons. No, since he doesn't have any depressive episodes. Full remission for part of the year. No. In the last 2 years, 2 major depressive episodes. No. So even if he did have major depression, which he doesn't, even if he did, you couldn't give him seasonal affective disorder, otherwise known as a seasonal pattern to major depressive disorder, because he hasn't exhibited enough cycles back and forth to know what's happening. If you wanted to say major depression, then fine, it's still wrong. But even if he did have major depression, you would have no idea if his depression is going to go away once it becomes summer again, because you haven't seen him in the next summer, so that you would know if he has a seasonal pattern to his depression. If he was depressed, maybe this is just the beginning of his depression, and then he just stays depressed for the rest of his life, regardless of the seasons, or the seasons have nothing to do with his cycles. So I just have to say, seasonal affective disorder is up there as one of the dumbest things I saw on the internet. His life has been really tough. His adoptive mother and father, Caitlin and Eddard, they're dead. His beloved brother, Rob, dead. Beloved sisters, presumed dead. Beloved, younger brothers, Bran and Rickon, presumed killed by Theon, who was supposed to be a friend. Beloved girlfriend, killed by his friends. Jon Snow, nothing. He's betrayed by Theon. Winterfell is burned by Ramsay, and so many people are killed. There's a huge army of White Walkers that are coming to kill everyone, and no one is trying to stop it. And many of his brothers in arms are killed by various different people, and so on and so on. These are terrible, demoralizing, depressing things, and in spite of that, he has persisted. He's the opposite of depressed. He's highly motivated. He must be at least, partially optimistic, because otherwise, why would he fight? If I was Jon Snow, I would have gave up long ago. I would have become depressed and just been like, what's the point? We're all going to die and no one's helping. And my own men are trying to kill me and they did kill me. And now I'm back to life. So yeah, is he depressed? Does he have major depressive disorder? I would say no. And, don't be stupid. Okay. MTV.com. Guess what? So far MTV.com has been the dumbest of all, even though they're talking to a clinician. So what could we imagine at MTV.com would say? Well, again, seasonal affective. Not seasonal affective disorder, just the phrase seasonal affective. Seasonal affective what? Seasonal affective joy. Seasonal affective happiness. Or, it's like what? They say, if anyone in Westeros has brain-based, biology-based mental health issues, I'd say that depression runs in the Stark family. It's just a weird phrase. If anyone in Westeros has brain-based, biology-based mental health issues, I'd say that depression runs in the Stark family. Sansa is clearly depressed. She has a depressed affect. Caitlin had that too at times. And Jon Snow, he's experienced a lot of loss, which is a trigger for depression. And it's also common for people displaced from home to experience depressive episodes. It might even be seasonally affective living that far north. Okay, end of quote. Me, yeah, stupid. This is a clinician talking. Sure, he's been through a lot and he's grieving, and that's made him sad. That's grief. But that does not mean he has major depressive disorder, and it definitely doesn't effing mean he has major depressive disorder with seasonal pattern. I mean, don't be stupid, people. You're just throwing around these terms as if, you know what they mean, and you don't. Stop it. You don't know these things. So get out of my kitchen. If you want to talk about Jon Snow's personality and he's like, oh, he seems kind of down, or he seems kind of forlorn, or his motivations are funny, or whatever, fine, great. You're just as good at that as any clinician is. You can wax and wane, or what do you call it? You can talk as much as you want about personality and motivation and character arc and what's deep down in him, and if you can relate to that, yes, go for it. I love that stuff. In fact, I watched that TV show that's right after Game of Thrones. There's a TV show that comes. So if, when a new Game of Thrones episode comes out, immediately after there's this there's this TV show, and I think it's HBO, that talks about the episode, these people. And I love all that stuff. But if you're going to come into my world, the mental health world, and you're going to start throwing around these terms, stop it, because you clearly do not know what you're doing, internet. You just don't know what you're doing. Okay. What is a blog a throne? Okay. So, whatculture.com, seasonal affective disorder, just dumb. MTV, seasonal affective ... also dumb. A blog of thrones, martyr complex. It goes on. Also known as victim complex, when a person exaggerates his own suffering and or persecutions, wanting to become a martyr for his own sake. In some cases, attributing their persecution to the exceptional ability of their own. John being a skillful castle-trained highborn bastard puts him at odds with the rest of the Night's Watch when he first takes the black, period. End of quote. All right. This is not a DSM label, martyr complex or victim complex, but, it's an interesting analysis. There are a number of times that Jon Snow actually puts himself in harm's way in a very public manner. And we might call this a martyr complex, or we might call this masochism. He's always volunteering for these extremely risky jobs. He went by himself to the wildlings when they were about to attack the wall, which was very risky and very public. He had been treated somewhat badly by the people growing up in his life. I mean, he's sort of a second-rate citizen at Winterfell, particularly when it came to Catelyn, his adoptive mother. And, when you have those kinds of experiences early in life and you're treated badly, you internalize that relationship, and it becomes a difficult internalized representational relationship inside your psyche. And so you sometimes, to cope with that as a defense, you end up abusing yourself through society, or sort of making other people know that you're being abused in some way. I could go on and on and on, but anyway, a blog of thrones, because a martyr complex is not a DSM thing, and because if I'm understanding what a blog of thrones writer is saying, sure, you could say that, and there's no criteria. It's all in the eye of the beholder in that one. So, and I can even sort of agree with it. All right, next person, Jorah Mormont. What does a blog of thrones say? They say obsessive love. That's the diagnosis. That's his mental illness, obsessive love. They say a state of mind in which a person feels an obsessive desire to possess a person to whom they feel strong attraction, with the inability to accept rejection from that very same person. Jorah has proved it many times that he is obsessed with Daenerys Targaryen, even saving her in the fighting pits of Meereen. Unquote. What do I say about this? Stupid. This is not a diagnosis. Obsessive love is not a diagnosis. It's not a mental illness as it's presented in this article. Jorah Mormont just merely loves her. That's not an obsession. If you understand what obsessions are, you understand this is not obsession. It's just, he just loves her. He's fond of her. He's dedicated to her. And for a time, he's her knight, and he's trying to do his job, and he feels bad about being excommunicated from his homeland. So he's trying to be a dutiful guy. And yeah, he loves Jorah. So that's not a mental illness. If that is, then 99% of the people on the planet have a mental illness called obsessive love, because everyone has that experience in life. All right. So, in conclusion, Jorah Mormont, any mental illness? No, of course not. Don't be stupid. Okay, Lysa Arryn. A lot of people have a lot to say about Lysa. Whatculture.com says borderline personality disorder. And what I would say is, yes, this time they're right. She is actually a good example of one particular presentation of borderline personality disorder. But to be clear, most people with borderline personality disorder do not look like Lysa Arryn. She's an example of it, but she's not an all-encompassing example of it. What does MTV.com say? Paranoid personality disorder and Munchausen by proxy. And what I would say is, yeah, actually people are getting this right. Paranoid personality disorder, I would say, is a possible differential when it comes to borderline personality disorder and Lysa Arryn. Could be, but I think borderline is a better diagnosis. but one could make the argument for paranoid personality disorder. And the Munchausen by proxy is possible. Again, we call that fictitious disorder imposed on another. The way she treated her son, it's possible, but I wouldn't say it's a strong presentation of Munchausen by proxy. All right, what does a Blog of Thrones say? They say delusional jealousy or Othello syndrome. So delusional jealousy and Othello syndrome. What do I have to say about that? That's stupid. Those aren't mental illnesses. I've never even heard of them. I guess I could imagine what Othello syndrome is. I guess it's referring to Othello in the Shakespearean play. Delusional jealousy. No, Lysa Arryn is not delusional. She's jealous, but she's not delusional. She's justifiably jealous. And Othello syndrome, I mean, come on. So conclusion about Lysa Arryn. Yeah, I would say, a good candidate for borderline personality disorder. Is she a typical borderline personality? No, because she's, she's quite aggressive and she's quite mean to people. But yeah, if I were to diagnose her, I would say, that's a good candidate. And clearly, so actually, in relation to this other talk that I'm trying to help people understand personality disorders, you never get the sense that Lysa Arryn is okay. Like, even when she is, even when things are going well, she doesn't seem happy, right? The actress that plays her is just brilliant because there's always something off kilter about her. There's always something. She seems to be suffering all the time. She doesn't seem to be happy with herself. She reacts very strongly to rejection. She becomes very emotionally dysregulated when she's threatened by people in a relationship way. And that's what people with personality disorders will do, namely borderline personality. Well, again, as I said earlier, when you are traumatized relationally and rejected, then you are very, very sensitive to rejection. And when someone rejects you, it brings back all those old feelings from when you were a very young child. And you essentially have a temper tantrum that is justified given how bad you feel, And so I shouldn't say temper tantrum. I should say meltdown. That's a better term. Temper tantrums are things that I guess we do on purpose at times, or at least sometimes. But a child, when they melt down, they're coming unglued. Their emotions are taking over, and they're melting down. And so when you've been traumatized in a way that makes you develop borderline personality disorder, and someone even hints at rejecting you, you melt down because you can't turn to internal resources to help you get through those moments, to reassure you that you're still a good person, to reassure you that you'll be okay without that person. You don't have that. In the same way that a 4-year-old can't turn to himself and say, well, I'll probably be okay if my parents reject me. If my parents drop me off in the curve, I'll be okay. No 4-year-old can do that. Well, when you're traumatized in those ages, and when as a young child, you retain that structure of personality, and as an adult, even though you're walking and talking like an adult, you feel like a 4-year-old does. And so Lysa Arryn exhibited that way of feeling. Now, the thing that's different about Lysa Arryn in terms of the typical, the vast majority of people with borderline personality disorder is that Lysa Arryn was an extremely mean individual. I mean, she had no problem, trying to kill Tyrion and just doing all these, and she was very strange with her son. And I actually know borderline personality disordered people who are actually great parents. So Lysa Arryn was a particular kind of borderline personality. Okay. What about Melisandre? Whatculture.com says histrionic personality disorder. blah, blah, blah. Let's see what they say. Affecting 4 times as many women as men, histrionic personality disorder is characterized by excessive attention-seeking behavior through the use of high drama and extravagant displays of sexuality. They crave stimulation, attention, and admiration and will use persistently manipulative means to achieve their own needs. Histrionic people will be overly emotional, theatrical, prone to rash decision-making, and likely to blame personal failures or disappointments on others, unquote. What would I say about this? This is stupid. It's a complete misunderstanding of histrionic personality disorder. I did, I think, at least a 2-hour episode on histrionic, so go listen to that if you want to. I think it's a patron-only episode, though. She's not histrionic. She's a religious priest. Melisandre she's a religious priest or priestess. So everything she does is in line with her religion and her job as a priest. So to call her histrionic is completely missing the point of histrionic personality disorder. And again, if you've experienced someone with histrionic personality disorder, you know that Melisandre, she does not present like that. What does MTV.com to say? And again, with MTV's track record, we could only imagine how stupid they're going to be. And guess what? Yeah, totally stupid. Delusional. Again, not a diagnosis, just delusional. They say, if we put magic aside, Melisandre has serious delusions of grandeur in terms of what she believes she's capable of, unquote. Okay, stupid. Yes, if she didn't have magical powers, then yeah, maybe something's wrong there, but she does have magical powers. So there's no evidence of delusions or psychosis. Don't be dumb. So conclusion, Melisandre, no evidence of mental diagnoses. She's a priest who is trying to serve her God and her king, who happens to be Stannis, which is, completely normal for religious leaders in this world. So there's no mental illness for Melisandre. She's fine. Oberyn Martell, the Viper. A blog of Thrones says sex addiction. Blah, blah, blah. A constant craving for the flesh that can distract a person from his tasks and duties. What do I have to say about that? Again, stupid. People love to use sex addiction as a label, and I'm getting tired of it, frankly. Oberyn Martell, he likes sex. Many people like sex. That doesn't mean that he's a sex addict. In our world, many people like to watch football, right? In our world, right? In our American football, a lot of people like to watch American football, but that doesn't mean that they're football addicts. And just because he likes to have sex, we don't even know how much sex he was having. I suppose if he was having sex 16 hours a day, then, maybe, but, we don't, he just, he likes sex. He's from Dorne. They seem like a very sensual people. Of the things that these royals were getting involved in, I would say sex is, one of the least harmful things that people were getting involved in. So is he an addict because he liked to have sex? No, that's dumb. So don't be stupid. In conclusion, Oberyn Martell, no evidence of diagnosis. Okay, Petyr Baelish, Littlefinger. Blog of Thrones says mythomania, or pathological lying. What do I have to say about that? Stupid. The term pathological lying usually refers to people who lie for seemingly no reason, or who, it's almost a compulsion to them. And it's usually, in my experience, the result of major attachment injuries and or child abuse. Littlefinger is playing the Game of Thrones, right? Just like everyone else is, but he's playing to his strengths. He's using his intellect and his guile, just like Robert Baratheon played to his strengths as a fierce warrior to become king, right? So Robert Baratheon played to his strengths with his huge hammer, and Littlefinger is playing to his strengths by using his intellect. So to call him to call him a pathological liar is totally misunderstanding what pathological lying actually is. Pathological lying is a legit thing. Believe me, I've come across it. So, it's legit. It's not a thing that's in the DSM, but it's legit. Anyway, what does thoughtcatalog.com have to say? They say antisocial personality disorder. They say he slithers his way into advantageous situations, manipulating everyone around him to get what he desires. They have a treatment plan because remember, Thought Catalog has treatment plan. Treatment plan: extended psychotherapy and a regimen of Prozac and Zoloft. What would I have to say about what thoughtcatalog.com is saying? That's stupid. Prozac and Zoloft. I mean, are you just pulling out random pills out of your head, and that's, like names that you've seen on TV, and for antisocial personality disorder, your treatment plan is Prozac and Zoloft. That's your treatment plan. Like, why are you even trying to, if you don't know what you're talking about, why do you even talk about it? Why don't you just say regimen of meds I've heard before? Like, hey, good boy. Well, now extended psychotherapy, it's debatable whether or not you can even help someone with antisocial, but there are some therapies that seem to work anyway, depending on the goal. But Littlefinger clearly doesn't care about human life, and he's willing to harm others for his own gain. So he does, in my opinion. So Thought Catalog is saying antisocial, and I'm saying, you could make a case for that. But again, he is. The question is he actually psychopathic? Is he actually antisocial personality, or is he just playing the Game of Thrones that everyone else is trying to play? It's hard to tell. Also, another data point here is he didn't seem to exhibit any psychopathic, mean traits prior to Joffrey becoming king. So when Joffrey became king, that's when Littlefinger started to kind of engage in a lot of these shady behaviors, which would eventually lead to Littlefinger participating in the death of King Joffrey. So maybe Littlefinger's antisocial behavior is just a manifestation of his intelligent efforts to establish a good leader on the throne. It's hard to tell. But similar to Cersei, he does show he does show a lack of empathy, and he does show a lack of remorse at the things that he has done. So at the very least, he has antisocial personality traits. So the conclusion for Littlefinger is antisocial personality disorder traits, but I don't think he has the full disorder. And definitely doesn't have mythomania. Don't be silly. Okay, we are all the way to Ramsay. But before we go to him, let's take a break. All right, welcome back. We're back from the break, and we're talking about Ramsay on this marathon episode in which I talk about the various stupid stuff that's being said on the internet, and I provide my own opinion. Again, as I said at the very beginning of this episode, diagnosing is an art form. It is not a science, as a lot of people would like it to be. It is highly in the eye of the beholder. It is subject to subjectivity and to opinion. And so I am providing mine. But as I also said at the beginning of this episode, there are things that the vast majority of clinicians would laugh at, and I'm trying to exhibit that laughing in this episode. Okay, Ramsay. A Blog of Thrones says antisocial personality disorder, and Thought Catalog says sexual sadism disorder. And I will say that these guys are getting it right. It appears that when someone is off the charts problematic, then the internet actually manages to get it right. I don't know why that is, but that seems to be the pattern. So a Blog of Thrones, antisocial personality disorder, Thought Catalog, sexual sadism disorder. So yeah, in my opinion, Ramsay had sexual sadism disorder along with sadistic personality disorder, which isn't in the DSM, but sexual sadism disorder is, since Ramsay demonstrated marked pleasure and complete lack of remorse from the suffering of others. He also suffered from antisocial personality disorder, which is in the DSM-5, or psychopathic personality disorder, which is not, which are both related to sadism and sexual sadism. He's the most problematic character in the show, along with the Mountain, in my opinion, since he clearly demonstrates tremendous pleasure in harming others in a variety of ways, and he engaged in frequent sadistic behavior, even though it would harm him in the end. For example, he raped and killed many, many people, many young women. And one time when he did this, it almost got him killed by Sir Roderick Cassel. So he enjoyed raping and killing women, even when it didn't help him. In contrast to Cersei's antisocial behavior, in which, at least from my memory, at least most of it, however, antisocial behavior was actually preserving. That's the thing about these personality disorders. It's another sort of add to the nuance of personality disorders. A lot of times, the sort of behavior that people engage in as motivated by their personality disordered issues, it actually is shooting themselves in the foot. People with borderline personality disorder frequently shoot themselves in the foot. Deep down, they are desperate, as most people are, but borderline personality disorder people are even more desperate for a strong, secure attachment. But because they react so strongly to even the slightest hint of rejection, they end up pushing a lot of people away in this tragic recreation of their original rejection when they were children. And so Ramsay exhibits this in that he is, he's sadistic, he's antisocial, he's psychopathic. He has, sexual sadism, which is just another way of saying you enjoy raping people. And his disorder gets in the way, almost gets him killed. That's just one thing to think about. Okay, so conclusion about Ramsay. He had a difficult childhood. I did a whole episode on Ramsay, so listen to that episode. Ramsay Bolton has a fascinating history, fascinating childhood. And he had a lot of biological, Roose Bolton was also psychopathic and was also a sexual sadist. He would rape and kill people. Roose Bolton would when he was young. So Ramsay may have gotten that set of genes that sort of set up an epigenetic situation to create that sort of personality. Plus, he experienced, a lot of difficulties as a child. So, which is common for people with these kinds of disorders. So the conclusion is Ramsay has antisocial personality disorder and sexual sadism disorder in a big way. It's one of the more obvious cases in a Game of Thrones or A Song of Ice and Fire. All right, Robin Arryn, Lysa Arryn's young boy, Robin Arryn, sweet Robin. A blogothrones.com says Oedipus complex. Oedipus complex. Quote, when a child has too much affection towards the parent of the opposite sex and resentment, even jealousy toward the parent of the same one. All right, what do I have to say about it? Sure. It's not an actual mental illness, Oedipus complex. It's not. It's never been in the DSM. So, it's one of those psychobabble terms that can mean a lot of different things. And a Blog of Thrones is not using this term in a bad way. Actually, it's a little close to the mark. Or I wouldn't be surprised that some classic psychoanalysts wouldn't use this term to explore Robin Arryn's personality. The idea is that because his mother is disturbed, he becomes stuck in this early stage of development, this Oedipal development stage, and he remains, as an older boy, he remains very dependent on his mother as if he still was an infant. So Oedipus complex, you could apply. So a Blog of Thrones, again, every once in a while, or a broken clock is right twice a day. Anyway, Blog of Thrones got it right. Oedipus, I mean, not right, but because a Blog of Thrones, if I remember right, is trying to present what they called, I think, medical conditions. And Oedipus complex is definitely not a medical condition, and it's actually also not a mental illness. Okay, Sansa. What do we say about Sansa? Well, whatculture.com says no, that she's sane. A Blog of Thrones says masochism. Quote, when a person obtains any sort of gain through tolerating mental or physical abuse from someone close to them. I just want to read this again, because this is one of the, this is so dumb but in a different way that I won't laugh at it. I'm just going to, it makes me angry, actually. So A Blog of Thrones says, masochism. Sansa suffers from masochism because she's a person who gains, who gets something out of mental or physical abuse from someone close to them. I'm sure you understand how utterly stupid and offensive this is. Masochism, Sansa being raped by Ramsay is, she gets something out of this. What sort of effing gain did Sansa get from being repeatedly raped and abused by Ramsay? This is idiotic, offensive, victim blaming, terrible, dumb. What? Masochistic? Sansa is masochistic. She gets, she's being abused. That's true. She's being traumatized. That's true. But you're going to claim that Sansa's getting something out of being, it sounds like a projection from whoever's writing this. Like you have some sick thing where you want Sansa to get something out of, it's just gross. Let's move on. Well, no, let me conclude. Sansa, no mental illness, don't be stupid. Okay, Sandor the Hound Clegane. Sandor Clegane the Hound. Again, I did a whole episode on him. Go listen to that if you want. A Blog of Thrones says post-traumatic stress disorder. Psychology Today says post-traumatic stress disorder and alcohol use disorder. What do I say? Yeah, they actually got this right. Blog of Thrones and Psychology Today actually got this right. Sandor clearly suffered from PTSD related to the ongoing extreme abuse he received from his older brother, Gregor Clegane. When he encountered the threat of fire, he consistently showed signs of PTSD, actual signs of PTSD. So remember when I was talking about people talking about Arya has PTSD? If you want, now Sandor doesn't have we don't have a full assessment on Sandor, but the reaction that Sandor has when he encounters fire, when King's Landing is being attacked by Stannis and all those people, and there's a burning fire, or there's all the wildfire. Anyway, Sandor, even though he's a brave, courageous, fierce warrior, he freaked out and ran. And where did he run? He ran to Sansa. He ran to Sansa and he said, "Sansa, let's get out of here." And Sansa's like, "No." And then he left. He just got out of town. I mean, that's how distressful that was for him. It was so distressful to him seeing all that fire that he needed to escape. It was like a claustrophobia feeling. So yeah, that's an example of likely physiological, but at least psychological distress as a result of the memory of the trauma being triggered. His older brother smashed his face into a burning fire, which resulted in massive disfiguring of his face. And so from that point forward, whenever he sees fire now, that deep trauma is triggered in him and he has a reaction. So yeah, we don't have all the criteria necessary endorsed for PTSD, but we have, I think, enough to say, yeah, probably PTSD. Sandor does not fit criteria for psychopathy or sadism since he demonstrated empathy and remorse mainly for Sansa and Arya, and he didn't seem to harm others for pleasure. However, other clinicians could apply the label of antisocial personality disorder or psychopathy or sadism because he exhibited callousness and some pleasure upon harming others. But in my opinion, that attitude was likely part of his job, similar to someone in the military during wartime. And also, Sandor used alcohol to cope with stress, which would likely justify the label of alcohol use disorder, but we don't really know because we don't have all the data. So in conclusion, the Hound suffers from likely PTSD, showed definite signs of that. And one could make the argument of antisocial personality disorder and sadism. not sexual sadism, but just general sadism. And there's likely a case of alcohol use disorder. All right, moving on to Stannis Baratheon. A blog of Thrones diagnoses him with stubbornness. Stubbornness is a mental illness. No, it's not. Sure, he's stubborn, but so is everyone else in this story. If anyone in this story deserves to be stubborn, it's him. He was the rightful king since Robert died, and Robert didn't have any legitimate heirs. So the crown was supposed to pass to him. And if anyone was supposed to be, quote unquote, stubborn, it's him. Plus, he almost won. His stubbornness, what you were labeling stubborn, was actually instrumental in helping him almost win. If Winter had been a little slower, or if he had managed to beat Ramsay, he might have kept marching south and gaining more power, and everything might have worked out for him. So, one person's stubborn is another person's determination. And I was kind of pulling for Stannis until he killed his daughter, right? But and of course George Martin loves to make people suffer, so of course Stannis had to lose to Ramsay. All right, let's move to Theon Greyjoy. Again, I did a full episode on Theon, so go check that out. What does MTV.com have to say about Theon Greyjoy? They say, quote unquote, complete break with reality, unquote. So that's their diagnosis. Again, a clinician was helping them write this. Complete break with reality. What in the world does that mean? Does that mean psychosis? Does that mean delusional? I don't know. It's not a diagnosis. It's not a complete break with reality is not in the DSM. So that's stupid. Plus, the basis of it is also dumb, which I'll get into in a second. A blog of Thrones, they diagnose with catalepsy, and it's even spelled wrong. Presumably, since you own a website, you can Google things, and catalepsy is spelled with an S, not a C. But anyway, catalepsy is what a blog of Thrones has diagnosed him with, which is not a mental disorder. It's not a DSM disorder. It is muscular rigidity or a fixed posture. So it's like catatonic in a certain sense. You can't move. You're stuck in a position. And what Theon Greyjoy had rigid muscles and a fixed posture. What are you even talking about? Psychology Today diagnoses Theon Greyjoy with narcissistic personality disorder, Stockholm syndrome, and dissociative disorder. You could make a case for narcissistic personality disorder given the way that he was acting when he was younger. I wouldn't say he meets the full criteria, but you could make a case depending on your definition of that personality disorder. Stockholm syndrome, absolutely. I'll get into more of that in a second. Dissociative disorder, no, and I'll get into that. So Psychology Today got, I think, 1.5 out of 3. WhatCulture.com, they diagnose Theon Greyjoy with psychotic break, which isn't a diagnosis. They diagnose Theon Greyjoy with dissociative identity disorder. They diagnose Theon Greyjoy with PTSD and Stockholm syndrome. Okay, so let's get into this. Yes, he clearly suffered from a tremendous amount of physical and emotional trauma, but it's hard to tell if he meets criteria for PTSD. We don't see him getting triggered. We see him anxious. We see him scared, but that's not enough for us to apply the label of PTSD. Really, his syndrome is more akin to Stockholm syndrome. The experience of that abused spouses will sometimes go through, and that he became submissive to the abusive person to save his life. Again, not in the DSM, Stockholm syndrome. He also lost his identity as a result of the trauma, not as a result of he lost his identity as a result of being tortured by Ramsay, which can happen when an abuser punishes identity congruent thoughts and behavior. So whenever Theon said, I'm Theon, he would get punished. And when he said, I'm Reek, he was rewarded. This was exacerbated, I think, by the pressure Theon experienced from his father, sister, and other people, other Ironborn, to be ruthless and psychopathic, which was counter to a sense of morality. So he had to do all these like atrocities, which were not really his thing. And this resulted in immense guilt and shame that contributed to him believing that he deserved to be punished by losing his identity. However, this was mainly what was presented to us in the TV show. In the books, it's less clear that he was remorseful. So again, getting in a narcissistic personality disorder, sure, traits maybe, but I wouldn't say the full-blown disorder. Again, if you have seen full-blown narcissistic personality disorder, you would definitely not think young Theon exhibited that presentation. Also, Psychology Today said dissociative disorder, and WhatCulture.com said dissociative identity disorder, and I just have to say that's like so dumb. Clearly, you do not understand dissociative identity disorder. And WhatCulture.com says psychotic break. MTV.com says complete break with reality. No, it's not psychotic. If someone abuses you to the point where you have to adopt a mindset that you are now weak and that you deserve to be punished, and this is day in and day out, if you adopt that's not dissociative identity disorder. And again, this is just another example of how the internet is stupid, and frankly, how some clinicians writing on the internet are stupid. I mean, you clearly just don't know what you're talking about. Dissociative identity disorder it's a rare thing, but it happens. And when you are traumatized, usually as a young person, repeatedly, sort of like every day, for a number of years, your personality splits into these different identities that sometimes don't even know each other. So the fact that Theon basically just probably made a calculation in his mind and said, look, I got to become Reek because that's the only way I'm going to avoid getting tortured. So become Reek, act like Reek, even think like Reek, and that will save my life. And it did. And then when the time came that he could become Theon, he went back to thinking he was Theon. But he was probably always Theon. He just was internally sort of adopting a character to survive. And that's not dissociative identity disorder. Don't be dumb. And catalepsy, I don't even know where that comes from. I don't know how a Blog of Thrones even got there. Is there something in the TV show or the books in which he becomes rigid in terms of his muscles? If so, then maybe, I guess. So I would say, if you want to be narcissistic, if you want to apply the narcissistic label, then sure, traits of narcissistic personality disorder, but definitely not the full-blown disorder. Definite Stockholm Syndrome, not a DSM diagnosis, but, a human phenomena. And maybe PTSD, but definitely more assessment would be needed. It's hard to say. All right, we have two more people. Oh my God. We have Tyrion and we have Tywin Lannister. Let's talk about Tyrion first. WhatCulture.com calls him alcoholic. MTV.com calls him alcoholic narcissist. That's the diagnosis, alcoholic narcissist. BlogofThrones.com says Napoleon/small man syndrome. Napoleon syndrome / small man syndrome, which I will quote, a known term to describe the inferiority complex that short men tend to possess. This causes them to overcompensate by putting more effort than men of regular height would. End quote. What in the world are you talking about, Blog of Thrones? That is the dumbest thing. It's not a known term. Known term to who? The internet? Napoleon syndrome? Small man syndrome? This is one of those, offensive stereotypes. You're short, you're little, and that automatically makes you have this Napoleon syndrome. Plus, Tyrion's a legit dude. Like, he has legit powers. He's smart and he's diplomatic and he cares about people, and he's trying to be bigger than I don't know. I don't even know what you're saying. Napoleon complex, like, that's just dumb. Thoughtcatalog.com, alcoholism. And again, since this site provides treatment plans, 90 days of alcohol rehab. 90 days of alcohol rehab. All right, what do I think? Well, as with Cersei, it's hard to tell what his drinking is really like in real life. Yeah, he drinks a lot, just like Cersei, but more assessment would be needed to see if he fit criteria. I mean, let's look at the actual criteria for alcohol use disorder. So there are different degrees. So but you need at least 2 of the following: taken in larger amounts than intended. Has Tyrion ever taken larger amounts of wine than intended? I don't know if we know that. I don't know if we know the answer to that. Persistent desire to use or unsuccessful efforts to cut back. So has he ever tried to cut back and failed at cutting back? Hard to say, but possible. Lots of time spent getting alcohol, using it, and being hungover. Again, unknown. A lot of craving. Probably. There were times when in at least the TV show that I remember, that he was like, "Where's the wine? I need the wine." Interference with work and with home life. Hard to say. He uses in the face of consequences. That's unknown to me. Gives up on activities in order to use alcohol. That's unknown. Does he use when it's dangerous to do so? Hard to say. Does he use even when he knows that it's harming him? Maybe. He seems to know that wine isn't the best thing, and he uses it anyway. Does he have tolerance? Does he need more to get drunk? I would say probably. Does he experience withdrawal symptoms when he doesn't, get alcohol? Yeah, I think they exhibited that, at least in the TV show. So he seems to qualify for a few of these. Now, I would not. So the DSM-5, the new DSM-5, the criteria for substance disorders, they have a very low threshold. So in order to qualify for the mild version of alcohol use disorder, you only need 2 of these criteria to be met. Moderate is 4 to 5, and 6+ is severe. So again, I just want to say this to you out there: if you drink alcohol and you qualify for 2 of these 11 criteria, then you have a mental illness. So again, I just want to, which I don't agree with, by the way. I think DSM-5 set the criteria way too fucking low. But anyway, so out of the 11 criteria, if you say yes, or even, kind of and maybe to these, then you have to admit to yourself that according to DSM-5, you have alcohol use disorder. 1, do you take in larger amounts than intended? Do you ever say, tonight I'll have 2 drinks, and instead you take 3? Has that happened to you? Number 2, persistent desire to use or unsuccessful efforts to cut back. Have you ever tried to cut back? Like, okay, I'm not going to drink as much for the next, few months. And then you don't succeed at that goal. Has that ever happened to you? Number 3, lots of time spent getting alcohol, lots of time spent using it, and lots of time being spent hungover. So it's sort of a higher threshold thing. So, number 4, craving. Have you ever craved alcohol? Like, boy, I need a drink. Or, you're just like, oh man, I can't wait to go out with my friends and have a drink. Or, I need a beer. Has that ever happened to you? Number 5, interference with work and home. Has your drinking ever made it difficult to be in your relationship, or difficult to work, or difficult for your, home life? Number 6, have you ever used in the face of consequences? Drinking more than 1 or 2 drinks, most of us understand that's not good for our health, right? So have you ever done that? Number 7, give up on activities to use. So this is sort of a higher level criterion too. Have you ever, for instance, not gone to a birthday party because you wanted to stay home and drink or something? Number 8, do you ever drink alcohol when it's dangerous to do so? Like, have you ever driven drunk or drank when you knew you had to drive home? Has that ever happened to you? Number 9, do you ever drink alcohol when you know it's harming you? So it's similar to the one I was saying before. Number 10, do you have a tolerance? And do you need to drink more now than you used to feel a buzz? Number 11, have you ever experienced withdrawal symptoms, which is basically a hangover? So if you have said, I don't know if you counted how many said yes, but if you said yes 2 or 3 times, then you have mild alcohol use disorder. If you said yes 4 to 5, then you have moderate. And if you said yes to 6+, you have severe alcohol use disorder. So the threshold is, anyway, it's hard to know if Tyrion had it, but he probably did. So we could probably apply either a mild or moderate alcohol use disorder to Tyrion, but he doesn't suffer from narcissistic personality disorder or Napoleon small man syndrome. As with Cersei and as with Jaime and as with a lot of these people, they are legitimately important people. And Tyrion Lannister, thinking that he is smart, thinking that he's important, it's true. He is important and he is smart. And so I wouldn't say he has a narcissistic personality disorder. Again, don't be dumb. Okay, Tywin Lannister. A Blog of Thrones says megalomania, because, quote, ruthless, amoral, highly ambitious, but with a thirst and lust for power, unquote. What do I have to say about that? Megalomania is not a diagnosis, and it's really true for many of the people in Game of Thrones that they're ruthless and ambitious and they lust for power. I mean, so why would you apply that? Tywin isn't acting really any different than anyone else would in his position. It's everyone has their job. This is all based on medieval Europe, right? And for those houses, when you are in charge of a major house, it's your job to sustain the house. And if that means being ruthless, then that's what it means. And if you aren't ruthless, then someone else is going to take you over. With Tywin, specifically, just, his story, when he was a kid, his dad, so, this is Tyrion's grandfather. So when Tywin was a kid and his father almost lost their seat of power because Tywin's father was weak and not ruthless. And a bunch of other houses, minor houses, rose up against Tywin's father and almost eliminated Tywin and his family from power, even from their lives. And Tywin, as a young person, actually stepped in and took over and fought back these smaller houses and sustained House Lannister. So if Tywin had not been ruthless as a young person, House Lannister wouldn't exist anymore. That's what the world that they live in. The reason why Tywin is ruthless is because he has to be ruthless, because the society made him into a ruthless person. So to call him a megalomaniac, like there's something wrong with him, just completely misunderstands the context. It's similar to when people will label an inner city kid who his only means of making a living and paying for food for his family is to sell cocaine on the corner and sell, meth on the corner. Well, he's breaking the law. And, maybe that involves being violent with rival drug people or something. Well, he has antisocial personality disorder. He's breaking the law. He doesn't have a regard for, other people's lives. What's wrong with this kid? He has a mental illness. But if you understand the context that this person lives in, then you understand, it's his environment. This is his life. He, for whatever reason, feels as though, and may be true, that this is his way to survive. And if he doesn't become ruthless, and if he doesn't sell drugs, and if he doesn't break the law, then him and his family will not survive in this environment. And so it's not a mental illness to survive, is the point. And Tywin Lannister is one of those people, and he does not qualify for a diagnosis. So I would say Tywin does not qualify for any DSM diagnosis. So, wow, how long was that? Was that 3 hours? My God. Let me know what you think. And I'll probably talk more in depth about other people. People want me to talk about Jorah. People want me to talk about Tyrion. It's fun, so I probably will. But anyway, let me know what you think about all this stuff. And again, if you haven't already, please become a patron of the podcast by going to patreon.com. When you become a patron, you get access to all these really super interesting deep dives that we've done over the years. So please, if you can, if you haven't already, become a patron. If you're already a patron and you up your situation to $20, then you will get a mug. I'm about to send out a bunch of mugs in a couple of days to some people who are in this category. I have to say, this mug is awesome. I use it every day, not narcissistically, not only because of narcissism, because my face is on it, but also because the cup is the perfect coffee cup, the perfect handle, the perfect size. It's kind of thinner and taller, but not too thin and too tall, if that makes any sense. Also, if you can, tell a friend or a colleague about the podcast. I think a lot of people hear about us through word of mouth. So if you're in a graduate training program, tell others around you. That's, spread the word. That's cool if you can do that. Also, if you can rate us on iTunes, that'd be cool. And let me know if you rate us on iTunes, and I'll send you some swag. Also, join the Facebook fan group, Psychology in Seattle Psychology in Seattle fan group, I think it's called. And it has a lively group of individuals there. Also, you can join our Instagram, of which I post a picture about once every 2 months. So there's that. Also, you can like the regular Psychology in Seattle page on Facebook, in which I post tougher bluffs every Tuesday. Yeah, out there, people. I know that there are people that probably don't know about this, but every Tuesday morning, I post a tougher bluff on the Facebook page, not the Facebook fan page, but the regular Facebook page. And it's always a lively participation situation. And people in my family, including my parents, often participate. So anyway, that is that for that episode. Thanks for sticking with it. And please take care of yourself and take care of others, because we all deserve it.